Hey everyone, Dr. Sultan here from Dentistry for Children, just to go over a case that came into our office a year ago. It's a 3-year-old boy. Picture that you see here is actually their visit after we applied the first set of SDF on top of their teeth. If you've seen any of my previous videos about SDF, you'll know that it helps stop the cavity from growth, but unfortunately it creates a lot of discoloration and staining, which wasn't a big priority for the family at the time. But as the patient kept on coming back for subsequent visits, we ended up noticing that the patient was starting to get a lot more cavities on the back molars, and given the child was 3, those back molars were the ones that he definitely needed treatment on, especially since he was going to need them for about 11 to 12 more years. So after a careful discussion with the family, we found out that SDF, or the smart treatment, had its limitations. It wasn't something that we could have continued to do for him, and we had to consider IV sedation since his level of cooperation in dental chair was not that great. So since we went to the extent of doing IV sedation for this patient, parents were all on board in terms of getting treatment done with the top front teeth, since they were saying, since we've already gotten to the point of doing this, might as well get everything cleaned up a little bit more. So aesthetically, we would consider doing zirconia crowns. So the picture here you'll see is basically the crowns that we did immediately post-operatively under IV sedation. And then this final photo that you see here is one that we did. We took the photo of 1 week after the procedure. As you can see, gums have healed up a lot better. Crowns look good. Patient had a big boost of confidence afterwards as well, saying that Mom told us that he would be reluctant to smile in front of his friends at the time. So this was a great way that we were able to consider this as a treatment option for the patient. But this just kind of gives you an idea that there's not one way to always do dental care. There's different ways. So for this patient, we started off with doing SDF, something that was very minimally invasive, but because of its limitations and the fact that the child had a lot more cavities later on, we had to do something that was more definitive and something that was definitely needed. Mother was happy, patient was happy. Patient is now cavity free. No new teeth have come with cavities, but it was a great way to make sure that we could prevent the progression of these cavities from moving forward.